help us fight infection. And the platelets help us to stop bleeding when we have a cut. Now, when we talk about leukemia, we are talking about cancer involving the white cells. And there are different kinds, about 5 main ones. And so leukemia is cancer of the cells, and they can be grouped according to how they present. Now, if onset of presentation is very short, you have a history of feeling unwell for maybe days to weeks, then we would say it's acute. When it's been going on for years, in fact, some people don't even know they have it until they do a medical exam, then we say it's chronic. Then you can also break down the white cells into another group, myeloid or lymphoid. So leukemia is a group of diseases or disorders that are characterized by the abnormal production of these white cells. And it involves the bone marrow and then the peripheral blood that we see. These cells are produced in the bone marrow, so I like to think of the bone marrow as a factory. So leukemia is indeed malignant white cells.
And the bone marrow would be, I mean, relating it to chicken, I mean, if I break my chicken bone, that stuff inside there, that is that's the marrow.
When you want to enjoy your bone, you kind of suck onto it. Yes. So we do have it in the human body as well. Yes.
How common is leukemia in Ghana?
Leukemia, as compared to the infectious diseases such as malaria, will be downside, but it is something that we are seeing. So I wouldn't say it's one of the commonest, but I wouldn't say it is rare. Yes.
Is it infectious?
It's not infectious and it's not contagious.
So you can't catch leukemia from somebody?
You can't. You can't. You can eat with the person, you can live with the person cannot give it to you.
How does one get leukemia? That leads to my question.
Interesting question. We don't know, Kafui.
Wow.
We don't know. And sometimes when you tell somebody the person has leukemia, the first question is, how did I get it? What did I do? You didn't do anything.
What are the theories?
Well, so what we say is that there are risk factors. Factors that somebody would have that would increase the person's chance of getting leukemia. So we do have some inherited diseases. We also have certain infections, So we have HIV, we have other viral infections that can predispose you to having that change. It's all about having an abnormal change in our genetic makeup, because the genes will contain the information that will give rise to certain characteristics that you have. So when there's an abnormality in that, then it means it's going to give rise to an abnormal production of something, and that is what leads.
And you said earlier that leukemia affects the white blood cells.
Yes.
Which is quite dangerous because they are supposed to fight off infections.
Precisely. So you have somebody who would come in and say, I've had fever, and because malaria is very common in our environment, you say, maybe I've been having malaria maybe twice a month or something. Sometimes they will come with sore throat. Little ailments that shouldn't cause a problem, but because the white cells are not working effectively, it then blows up into something else. What are the symptoms? I mean, what does one have to start feeling before you start thinking, okay, maybe I should go and get myself checked out for the test? Unfortunately, in Ghana, we do not do frequent checkups, So with the acute, that's more aggressive. So then you are down with fever, you have certain swellings, we call lymph nodes, all over your body. Your blood level is down, so you feel dizzy, you are easily fatigued, you have swellings in your armpit and all the likes of it. For the chronics, usually you're walking around, you don't know you have it. Until you start feeling something in your tummy, especially on your left side, that's the spleen, one of the organs that get infiltrated by these white cells. It is there, it's not bothering you, oh, what is this? Now it starts getting bigger. Then it takes up your tummy. And then when you eat, you realize that after just taking a small amount, you just get full. That is when the person comes into hospital. And then we do a full blood count. A full blood count is just a test that will tell you the various cells in the blood and certain characteristics. So you do a full blood count and you realize that your white cells are up the roof. And depending on whether it's the myeloid kind of white cells or the lymphoid, then you are, I won't say in trouble, but then it means you have something going on.
Okay. Yeah. How expensive is this test?
It's not. With 20 Ghana, 30 Ghana, you should be able to do it. Sometimes for certain facilities, most of the time is on national health insurance.
Okay. So
it's something that you should do. One thing I keep telling people is that when you want to do your blood level, don't just go for an HB, go for a full blood count. Because it gives you the whole spectrum of the cells. It tells you the numbers, are they in their right numbers? Because even if it's increased, there's a disease condition. And even when it's decreased, there's also a disease condition.
Okay. Yeah. So go for the full blood count, not just HB.
Go for the full blood count.
Free tip here from Dr. Bene. Indeed. Okay, so now, assuming that one has gone for the test and they say, okay, well, likelihood of you down with leukemia, what are the treatment options? Okay,
so you start with your full blood count, and it's an indication that there's something going on. But as I mentioned, the bone marrow is a factory. So you want to get into the marrow and find out exactly what is happening. So we do a bone marrow aspirate. Now, we can go further to look at the mutation or the change that has occurred, that has given rise to this thing. You can do cytogenetics. You can also look at the cells. There are certain markers on it, flow cytometry. And all this, if you do all this, at least that confirms the diagnosis. And then you'd have to treat. Now, it is a cancer, but it's not a hopeless situation. I always say that when it's diagnosed early, then your chances of doing better, because then the complications don't set in, and you are at a better chance of doing it. So the first option we have in our environment, and for most centers, will be chemotherapy. And chemotherapy is just medication that are fighting cancer cells. But there are different types, and depending on the cancer, we have different chemotherapeutic agents.
So are these, what form do these medications take? Is it pills?
For most, especially with the acute, it's through intravenous. So we give it to you through an injection, through an infusion. Yes. There is one type of chronic leukemia known as chronic myeloid leukemia. And we now have orals, so we're taking tablets.
And then how often are you on this medication? I mean, this the intravenous action, is it once a month, once a week?
It's a protocol that we follow. So for the acute, so we have acute myeloid leukemia and acute lymphoid leukemia. For the acute lymphoid leukemia, we are looking at taking these medications, per protocol for about 2 years.
2 years?
Yes, for about 2 years.
Every day?
Weekly, sometimes 3 to 4 days in a week, or sometimes weekly, depending on the stage. We have an induction phase, consolidation, and then we have a maintenance phase.
And then if you go through these 2 years, will you get cured?
It's a cancer, and we are trying to control it. So the chemotherapy, some people do get cured, but the best chance of getting a cure is bone marrow transplant. That is getting rid of the bone marrow you have, because that is producing all the bad cells. So you get rid of it by loads and loads of chemotherapy. And then you transplant somebody you are compatible with, the bone marrow of that person, and you give it to the person who has leukemia. And once, barring all the risks involved, if everything is okay, then the person's marrow will start producing normal ones, and then you can say you have achieved a cure.
It sounds like a very painful process, getting the marrow from somebody else and putting it in the
No, now it's much simpler. First, the donor will have to be put to sleep, and they have to do the aspiration several times to get the cells. But now we have some machines, you hook the person to it, and as the blood is circulating through the machine, we harvest the stem cells. The stem cells are the youngest cells, or the cells that give rise to all the cells. So shall we say maybe the grandfather of all the cells.
Ancestor cells.
Yes. So they pick it up, and then so you just lie down comfortably. You get hooked onto the machine, of course, through the intravenous setup.
It doesn't penetrate your bone?
No, it doesn't.
It doesn't?
It doesn't.
Okay.
It doesn't.
And is that available in Ghana?
Unfortunately,
the bone marrow
not.
transplant?
It isn't. Recently, there is a team who are doing bone marrow transplant for sickle cell disease. So we hope in the future they will be able to address or take in patients who have leukemia. The preparation for a bone marrow transplant for sickle cell is less intensive than that of a leukemia. And for leukemia, you really have to get the disease under control.
Okay.
And because your immunity is involved and all that.
So the options open for Ghanaians
is chemotherapy.
Chemotherapy.
Yeah.
Okay. And is chemotherapy on national health insurance?
No.
Wow. How expensive is chemotherapy? How much does it cost?
Very expensive.
Tens of thousands? Thousands?
I would say that for somebody with an acute leukemia, we are looking at more than 10,000 Ghana cedis.
Wow.
And that's only for chemotherapy. But before you can give somebody chemotherapy, you have to stabilize the person. And because the marrow is not working, you have to transfuse the person. Sometimes you have to give the other components of blood, other cells like the platelets and all that. So it is expensive.
Quite expensive. Well, I'm having a chat here with Dr. Amma Bene. She's from the hematology department of the Kolebu Teaching Hospital. We're looking at leukemia, and we're taking your calls right now. So, yes, she's on duty for you for the next couple of minutes. If you have any questions related to leukemia, you can place a call to us. Number is on your screen. Give us a call. When you get through, turn the volume of your TV to 0, speak to the phone, and then you can chat with Dr. Amma Bene. Okay. You said it's not entirely a death sentence if somebody has leukemia, but what is the average lifespan if somebody is down with chronic leukemia?
For chronic, you control it. Very difficult to cure unless you have a bone marrow transplant. And chronic myeloid leukemia, there's been a whole radical change. The new therapy that fortunately we enjoy in Ghana is by courtesy of a foundation in the US.
Okay.
So it's free.
Oh, wow.
And so you're looking at 10, 15, 20 years more.
Okay.
Even out there, because we see our cases late.
Okay.
But out there, when they see it early, it's more like a normal lifespan.
Okay.
Acute is a different story. Acute, I mean, the optimum treatment would be to have a bone marrow transplant.
Okay.
Having said that, some people have been cured.
Okay.
It affects both children and adults, and
well.
especially the children, they do well.
Okay.
Yeah.
Can we take a call right now? Do we have a caller on the line? No, we do not have a caller on the line. Or we do. Hello, good morning.
Good morning.
Yes, you're live on GH1. Good to hear from you. Any questions for Dr. Bene?
Yeah, King Gav, I have a question. I wanted to know if there's something called multiple myeloma, because my mom passed away 6 years ago.
Okay.
And she was diagnosed with something they said was called multiple myeloma. I think cancer of the red blood cells, I think.
Okay.
She was given 4 years by Kolebu doctors to die, but she stayed till 9 years. So I wanted to know if there's anything like that, and if you have leukemia or something in relation to that.
Okay, did you hear the question? Multiple myeloma. Yes.
Multiple myeloma is not a leukemia,
okay,
but is a hematological cancer.
Something to do with the blood, but not leukemia.
Okay. And again, because it's hematological, we're dealing with blood and blood cells. So with multiple myeloma, we have one of the white cells known as lymphocytes, and they give rise to another cell known as plasma cells. So of course, this occurs in the marrow, it's produced in the marrow because it's part of the blood. So it's these plasma cells that go haywire.
Okay.
Yeah.
All right.
And then that's what gives multiple myeloma.
Okay, let's jump back to the lines again. Good morning. Hello, good morning. Ago. Okay, we don't have you, so when we have you, we will get through to you. Okay, so there's a question here. Can the disease go away on its own?
No.
Simple and sweet.
Yes.
Yeah.
It's a cancer.
Okay. All right. Should I consider clinical trials for leukemia?
We would love it, love it. Unfortunately, we do not have certain things, by way of diagnosis. What we are doing now really is having a full blood count and looking at the cells under the mic. If we're able to look at the mutations, if we're able to look at the markers on the cells, then that is where the Western world have gotten into. So they will be more interested in having clinical trials with us. But definitely we would love clinical trials. Yeah.
Okay. A very abrupt question here. Can you die suddenly from leukemia?
Yes, you can.
You can?
Yes.
Okay.
If it's not treated, because when these cells multiply, they invade all your organs. Your liver, your spleen, your immunity is down. So if things are not checked so that the normal cells are not produced, then you can.
Okay. All right. We'll still take a couple of your questions right here on the show. Yes, we have another caller here. Good morning. Good morning.
Good morning.
Yes, you are live on Healthy You on GH today. What's your name? What's your question for Dr. Bene?
My name is Labi.
Good.
My name is Labi. I'm calling from Kumasi.
Yes.
I've been following your program and it's been good. I'm asking, living with leukemia, I just switched on my program and I saw you discussing it.
Yes.
Does it have any indication or implications, like symptoms, to indicate that somebody is a leukemia patient?
You want to know what the symptoms of somebody living with leukemia look like? Is that correct?
Yes.
Okay.
Yes.
All right. Okay. Well, thank you very much, Labi. Dr. Bene?
Yeah, somebody with leukemia can have symptoms like any other disease. So you get easily tired. But the other thing is that you might have certain swellings. You keep getting infections. You have fever. You start losing weight. You have certain masses in your abdomen.
Okay. And the swellings where?
Around your neck, your armpits, and your groin.
Lymph, are these what you call the lymph nodes?
Lymph nodes.
Okay,
yes.
all right, okay.
These are lymph nodes.
All
but
right.
for the chronic, you might be walking around and you are very fine, but the process would have started.
Okay.
So some will present asymptomatically without any symptoms. Yeah.
Okay, we're wrapping up this conversation on leukemia, the challenges in treatment. I'll take the last caller. Good morning.
Good morning.
Hi, you're live on GH1. What's your question for Dr. Bene?
Doctor, the bleeding aspect, is it from... Hello?
Yes, she's here.
Yes, when it to be bleeding, is it from your private part, or how is it like? Just, it seems I'm having more symptoms you're talking about. I've lost weight. I have this pain in my left side of my tummy. Even yesterday, I complained to my doctor. Fortunately, I have a lab request to do all the tests today. But I'm kind of scared because I started having bleeding anytime I meet with my partner sexually. Can it be a factor too?
Okay, well, okay. Thank you very much, Doc.
Okay, this is to encourage you. I mean, it might not be leukemia, but it's good that you do your tests as soon as possible. Now, the bleeding aspect is that people bleed from their gums. Sometimes when you brush, you realize that you're bleeding. Sometimes when you get up, you just see blood clots in your mouth. Okay. But you can also bleed because the platelets are not being produced, so the bleeding has been compromised. Control of bleeding has been compromised. So you see blood in your urine. If you're a woman, you realize that when you have your menstrual flow, it's abnormally a lot. Okay. You're bleeding from your mouth. When you go to the loo, you realize that the color of your stool has changed. It's very black. That means that you're bleeding somewhere in your intestines. Okay. So various manifestations of the bleeding.
Bottom line, go and get a checkup.
Yes.
Indeed. What's your final word, really, Dr. Bene, for those who are watching? And if there's one thing they can remember from this conversation, what should it be, really?
I would say that leukemia, although it's not as popular as infectious diseases, it's in our environment. Please, when you are sick, don't say it's malaria and self-medicate for over a month treating malaria. Just get into a clinic and make sure that you have at least a full blood count. I'd also want to urge all of us that management of leukemia is very expensive. Please, let's all as a populace get involved to get help for people living with leukemia.
Okay. Is there like any foundation or something that people can contact and if they want to support?
There is a leukemia foundation. There is also, you can come to the department and talk to us if you want to help. There's also a patients group made up of doctors, nurses, and people living with chronic myeloid leukemia.
Okay.
So there are avenues. You can just contact us and we'll let you know.
All right. Dr. Ama-Bene is from the hematology department of the Kolebu Teaching Hospital. We'll be looking at leukemia. Thank you very much.
Thank you, Kafu. Thank you for
having me. Have a beautiful day.
You too.
Okay, and What For You was brought to you by Yum Vita, a delicious way to grow. And this news is just coming, which I would like to share with you. So the stalwart of the new patriotic party, J.H. Mensah, has passed away. Reports indicate that he passed away today, Thursday, July 12th, from complications arising from a stroke he suffered in 2017. He had been at the 37 Military Hospital for the past 12 months. He was 89 years old. J.H. Mensah, a Gold Coaster born in October 1928, is a founding member of the governing New Patriotic Party and served in 3 different ministerial positions under the John Agyekum Kufuor administration. He was a former minority leader and a majority leader and held his last top government position in 2005 when he was appointed senior minister by President Kufuor. His working experience dates back to 1953 when he was appointed as an assistant inspector of taxes by the colonial administration. The senior minister of government business also worked as a research fellow in economics at the University of Ghana between 1954 and 1958. He joined the United Nations Secretariat in 1958 as an economic affairs officer at the Center for Development Planning, Projects and Policies in New York. In 1961, Mr. Mensah was the head of agency at the National Planning Commission of the Government of Ghana, which drew and implemented the country's 7-year development plan spanning 62 to 69. During the Progress Party administration from 69 to 72, he was the Minister of Finance and Economic Planning, as well as a Member of Parliament. Between 74 and now, Mr. Mensah had worked in different capacities, both home and abroad. And so that's the news we have for you. New Patriotic Party stalwart J.H. Mensah has passed away today, July 12. More on our news bulletin at 11:30, God willing. We take you straight to the traffic check right now and continue the show.